Assalamualaikum everyone, welcome back to my channel. Today we are going to cover two very important lab tests, ESR and C-Reactive Protein. These are widely used to detect inflammation, infections and autoimmune diseases. Let's make them super simple. First of all, we'll discuss what is ESR. ESR is Erythrocyte Sedimentation Rate. Now, what is principle of this test? If you take some blood in an anticoagulant additive and wait for some time, you will see that the RBCs will settle down at the bottom and distance in millimeter of RBCs fall in 1 hour. This is sedimentation rate. You will see that the plasma gets separated and RBC sediment will settle at bottom because of rouleaux formation. What is this rouleaux formation? Normally our RBCs are present in free floating form, as we all know that. But due to effect of some factors like fibrinogens, immunoglobulins, RBCs undergo rouleaux formation, which is coil stacking arrangement of RBCs. This causes sedimentation of RBCs. The normal values of ESR in men are up to 15 mm per hour and in women up to 20 mm per hour. It is measured by two methods, Winthrop's method and Westrogen method. In Winthrop's method, the tube is closed at lower end and open at upper end, while in Westrogen method, tube is open at both ends. Winthrop's contain less volume of blood and Westrogen contain more volume of blood. In Winthrop's method, EDTA is used as an anticoagulant, while in Westrogen, sodium citrate is used. The Winthrop's tube is 11 cm and its diameter is 2.5 mm, while Westrogen tube is 30 cm long and its diameter is 2.5 mm. Westrogen method is reference method for calculation of ESR. When blood is left alone in an upright test tube, the sedimentation increases over time, but the ESR stays the same, which indicates how quickly the sedimentation happens. ESR is increased in various pathological conditions like infections, autoimmune diseases, tuberculosis, rheumatoid arthritis, and malignancy, and it is decreased in polycythemia, sickle cell anemia, low plasma protein, and leukocytosis. Physiological conditions in which ESR is increased include old age, female sex, menstruation, and pregnancy, and it is decreased in young age, in male sex, and dehydration. Now let's move towards CRP, which is C-Reactive Protein. CRP is an acute phase protein produced by liver in response to inflammation. Its normal value is less than 6 mg per liter and it may vary by lab. CRP is synthesized by liver in response to factors released by macrophages and adipocytes, which are fat cells. Its physiological role is that it binds to lysophosphatidyl and activate complement system via C1q. CRP is an early and sensitive marker of inflammation. It rises within 6 to 8 hours, peaks at 48 hours. It is useful in bacterial versus viral infection differentiation. It is used to monitor treatment response in infection or inflammations, and it is prognostic marker in cardiovascular diseases. This picture shows a CRP rapid test strip interpretation. The C indicates control line, which means that the test is valid. 3 test lines T1, T2 and T3 indicates intensity and number of lines, which depends on CRP levels in blood. Negative results means that the only control line is visible and its value is less than 10 mg per liter. In positive results, the CRP is between 10 to 40 mg per liter and there is control line plus one line T1. In positive results, between 40 to 80 mg per liter, there is control line plus two test lines T1 and T2. In positive results, greater than 80 mg per liter, there is control line plus three test lines T1, T2 and T3. CRP is an acute phase reactant elevated in infections like inflammations, trauma, autoimmune diseases. Higher value indicates more severe inflammation or bacterial infection. So CRP and ESR are both markers of inflammation, but CRP is more specific and faster. ESR is still useful in chronic conditions, and this strip test is quick way to measure CRP levels in lab or even bedsides. Hope this video made it simple for you. Thank you so much.